Now, again, muscle testing is fantastic, simple. You have to have some biological preparations, anatomical slides with molds on it, and then you can test the patient with muscle testing and know whether they have this mold or not, and then take your steps from there. The third one is the bacterial endo and exotoxins. I feel right now the most important test for that is a test for Lyme disease, and there's only one lab that stands out. It's called IGeneX. IGEN, E and then a capital X. It's a US government approved lab, has got all the approvals and credentials, and they do a test called the Western blot test, which I feel is the most reliable test, and everybody else in the field feels it also. The trouble with the Western blot is similar to the heavy metals. The immune system, what we're measuring is basically immune responses to the presence of Lyme spirochetes. These immune responses are suppressed by the presence of the spirochetes. So it's an illness also where you should treat the patient first for 4 to 6 weeks and then do the lab work. And similar to the cilantro challenge, we do here what's called the Samento challenge. Samento is Uncaria tomentosa, is a antibacterial herb from the Amazon rainforest. It's available in a tincture, and the dose in a child is usually 6 drops twice a day for a month, and then we do the challenge test. Now, this is already a challenge. If you give 6 drops twice a day, and the kid after like 2 or 3 days gets violent and gets at its worst behavior, it's a positive challenge.
Okay.
We know there is an infection involved in this process. We don't know exactly which one. Lyme disease is the most common, but there's others, mycoplasms, streptococci, staphylococci. There's other infections that can be behind that. If the child gets out of hand under the challenge, we ask them to roll back, sometimes even to just 1 drop a day, until the symptoms are minimal and the child gets through that. And then after a month to 6 weeks, we order this lab work, and very, very frequently find Lyme disease in these autistic kids. It has been completely overlooked, and so far has really not even been part of the discussion in the field. And yet, since we have a viable treatment now, the treatment is simply 2 herbs that are given for a long period of time.
It's pretty effective.
It's 80% of the kids get well with that. Yeah, it
Why
works.
does
It
Lyme-
works better than antibiotics on the long run. Has a higher success rate, and we combine that sometimes with some electronic equipment. The TENS unit that contains these microbial inhibition frequencies that helps with subduing the bugs in our system.
Why, just really quickly, so parents will understand when they have a doctor who goes, oh, Lyme, poppycock. Why does Lyme have such a bad rap as far as nobody seems to understand it? It just, what's up with that?
Well, there's 2 levels to it. It's similar to the heavy metals. It's what the heavy metal issue used to be.
Okay.
When I first lectured on heavy metals, I was called a charlatan. I was not back invited to meetings. I was ridiculed. Now, the same people that did that are all claiming that they're expert on heavy metal toxicity now.
Okay.
The same curve we've had with Lyme disease, that we first discovered it through muscle testing.
Okay.
Then a microscopy test came around that found it in a high number of people. And then the lab people caught on to it and developed the ELISA test for it and said, well, we find it rarely. And then, however, when we treated the people after a few months on antibiotics, we repeated the test, they all came out positive. So we either had given them Lyme disease with the antibiotics,
Right.
or it was necessary to treat them first before the lab diagnosis could be made. And since conventional medical doctors don't understand that, that if you have an infection that disables the immune system from producing the antibodies, which we then measure in the lab, that the test will come out in a high percentage of numbers negative as a proof that the infection is there.
Right.
Right.
Yeah, it's a similar to the mercury not showing up in the hair. It's a very,
Right.
very similar issue. So we treat first for a little bit. We use a simple challenge, an herbal challenge. Then we do the test. When I find it with muscle testing, over 90% now of my patients that are muscle test for it test positive with the Western blot, conventional blood test.
Wow.
With this method. And I would say amongst my autistic kids, it's about 1/3 of the kids have this issue present.
Just 1/3?
About
Okay.
1/3, yeah.
Let me ask you this on the, looking at your autistic kids, Don, if you take that sampling of 1/3 that you've experienced with Lyme disease, is that third separate or concurrent with also has mental issues or brain damage issues?
Same, yeah, it's the same group. So the autistic kids that have Lyme disease usually are the worst ones also with the non-excretion of the metals.
Right.
Yeah, so they're the same ones that don't excrete the metals, so they build up high levels of toxic metals, and they're often the ones that had the more severe injury at birth.
So it's not one that can be apart, just Lyme disease, autistic kid. It typically is associated with metals.
Yeah. Yeah.
And we're going to
and
get to that, right? I really, at some point, want to get to the whole concept that I sort of came up with that was an extension of the Klinghardt axiom, but I think the logical order for that will be when we go over the Klinghardt axiom,
Yeah.
which
yeah.
I think soon we'll get to.
Well, we can do that now. So the Klinghardt axiom is very simple. It is, we looked at, initially I looked at who are the people that accumulate the metals and who are the ones that are not.
Yeah.
And there was this genetic theory around, sort of, well, it's people that have all these genetic defects. And there was some truth to it. But we found also a large percentage of kids that were accumulating metals that have completely normal looking genes. In the, normal by comparison with the normal population. We all have defects.
Right.
So,
Right.
but they didn't stand out at all in terms of the patterns that they had. And I realized if there was an unresolved trauma in the family or a lot of psychological burden on the child, that these were often the children that could not excrete metals. And so the Klinghardt axiom is that for each unresolved psychological conflict, the sum total of unresolved psychological issues, there's an adequate and equal amount of toxins that the body accumulates that it cannot get rid of. And as you working down on the psychological issues, there's a certain number of toxins that are now free to be liberated and come out with very easy methods. Whereas when you can give all the DMPS and DMSA and EDTA in the world, and if you can go ahead a little bit of the toxic emotional issue, you can go down a little bit, but then the kid won't detox anymore. Nothing moves. And you do a little intervention here, the intervention itself doesn't do anything. Yeah, but you work this down, you don't see this, and suddenly you give a little cilantro, a drop of cilantro, and there's a massive slew of mercury coming out in the urine. Yeah, so you have to take these down together, the psycho-emotional and the toxin issue. And then Dana expanded that, and we really looked at, well, it's not just the psycho-emotional stuff, there's a whole bunch of other things in here that she calls the energetic burden. The geopathic stress goes in there, and other phenomena. And then we realized that it's really not just these two cups that are always in balance with each other, but there's a third one, and that's the microbes. That when we have a toxic burden, the immune system gets paralyzed from this. The toxins are also toxins to the immune system, and the more toxins you have, the less functional your immune system is, and the more opportunistic microbes grow in the system. So there's really these three cups: the unresolved psycho-emotional burden a child carries, that has to do with ancestral issues very often, more so than his own issues in his own life, but unresolved trauma 2, 3, 4 generations back.
And for the readers, on the 3 cups, on that cup, what is the biomedical basis for it? What effect is it doing for the release of toxins, or not doing for the release of toxins?
Well, the physiology, I discuss it in my workshops, but it's a complicated discussion.
I'm sorry, okay.
But it's really like in the science of psychoneuroimmunology. Yeah, it's very well outlined, the science, how from the psyche
Yes.
the effect is on the nervous system, and from there on the immune system. So that is very well outlined with the thousands of papers.
But in
or so.
broad strokes, if there's a psychological burden, those motor pumps ain't gonna work.
Exactly.
My Texas
Yes,
slang.
yes.
Yeah.
Absolutely,
Okay.
absolutely. If absolutely, as simple as that, if there's a lot of psycho-emotional burden, the pumps ain't working, and the kid starts to accumulate.
And to fix a psychological burden, you and I both know probably that takes just loads of.
No, that doesn't. No, that's the beauty about it, that we sort of investigated that for 30 years. I studied psychology after medicine and had an eye on that all these years, and we've selected out of the huge arena of psychotherapy the methods that are the most pointed and fast to address these issues. The ancestral issues, we use a technique called family constellation work, which usually resolves the major pieces in just one treatment, which takes about an hour or so, and is done in a group setting. And then for the trauma that's in the lifeline of the child, from conception to however old the child is now, we use the new techniques of energy psychology, which combine eye movements and color glasses and tapping of acupuncture points with recalling traumatic events, and that resolves issues very, very quickly. And so usually we don't spend more than 3 months, on the psychological issues, maybe 3-4 sessions dedicated to them.
But one thing that definitely belongs here, because a lot of these parents I don't think are going to be able to be outside of the box enough to sort of go with even that whole conversation. But I know early on when we came, in the very first visit, you taught us something called the tapping technique. And I feel like, and what you said about the tapping technique was, you said, I got 2 kinds of patients, the ones that heal and the ones that don't heal. The ones that heal tap 3 to 4 times a day. But I feel like what the tapping technique represents, considering it takes about 5 minutes to learn how to do it, and it takes about 30 seconds to do it, is it's a tool that these parents can use rather than any of this other stuff, buying into it. All they really have to believe is that while they're tapping, they're setting an attention on their kid. And it's a way to start to fix that energetic burden without taking on the burden of really understanding all that goes into it.
Yeah, so we have a shortcut to all this, basically to separate the unresolved psychological stuff from its effect on the body.
Yes.
And you can do that by simply 4 times a day tapping a series of acupuncture points on the child. And by doing that, it sort of separates the unresolved psychological stuff from the body, frees up the body. And we've been able to demonstrate that when you take a medication and tap immediately afterwards a series of points, that you get a much higher uptake of the medication in the gut, but also in the area of pathology. You concentrate the medication at a much higher level in the brain or wherever you need it to go. This is called drug uptake enhancement technique, DUET.
DUET.
Yeah, and so
like acronyms.
And so we've been developing a number of energetic tricks that are really, really important, simple tools, but really, really important. And
so the 3 pots, you started to summarize the 3 pots then.
yeah, so the 3 pot.